See you, Kit. What's happening? Thank you guys for jumping in. All right. Well, you're going to get a little bit better at fundamentals today, I promise. Okay. For nursing school, my best piece of advice is to find a battle buddy. I love that. Yep. Find your ride or die. Find them early. All right. And you'll know. You guys will make eye contact and orientation and be like, sup? And then that's it. And then you guys are just bonded for life. All right. Any other wins? Anybody else recently get notified that they passed the NCLEX? All right. Trauma bond is absolutely right. I take Peds next semester. Hell yeah. I enjoyed Peds. We had really good instructors though. Not everybody is this fortunate, but I'm still very much friends with my my Peds instructors. Still chat with them on Facebook and they like all my videos. So I feel like I'm at least doing something right in their eyes. All right, guys. So Peds and Peds fundamentals. Okay. So I'm going to start. This is a live. So for some of you who are new, some lives Tuesdays specifically, I do a question strategy. This is going to be more, here's the question and let's work through the answers. Okay. So we'll kind of go at a decent pace so that we're not seeming like we're really bogged down here. Okay. So, all right. Let me just get this situated. All right, guys. And we are off. Let's go. All right. So drop your answers in chat as always. All right. You're an RN in a pediatric outpatient surgery center. All right. You had a tonsillectomy. One child had tonsillectomy earlier today and is now at home. The guardian reports the child won't stop swallowing and vomited small amount of dark red fluid. Which call should the nurse return first? This is one of these where there's just a lot of distracting information. And this question, as you'll see. All right. Yeah, we're just warming up our brains here. So yeah, it's going to be that 7-year-old for sure, guys, right? The post-tonsillectomy. So that frequent swallowing after tonsillectomy can be a subtle sign of some sort of active bleeding at the surgical site. Okay, and the dark red bloody emesis suggests that there's probably some sort of hemorrhage. All right, so good job. Let's keep this trolley moving. Let me, sorry, I messed up my background. Okay, here we go. Whew. Okay. You're an RN caring for a school-age client on a PED unit. The team includes an experienced UAP and a newly hired LPN, and you are managing multiple competing priorities. One client is newly placed on contact precautions for profuse watery diarrhea, and another has a new diagnosis requiring teaching. Which task is most appropriate for the RN to delegate to the UAP? All right, keep dropping those answers in. Yeah, so anytime we see anything being delegated to a UAP, guys, we need to make sure they are stable. And so let's find an answer that has any semblance of stable, and we will find it in A, right? Yep. So yeah, routine vital signs on a stable patient are going to be a predictable task that does not require nursing judgment. That's absolutely right. All right. All right, read that. Ooh, everybody's favorite. You've never seen this before. Let's go. I hope you brought some paper. I hope you brought some paper, ladies and gentlemen. Let's go. All right, so the prescription reads amoxicillin 45 milligrams per kilogram per day, PO, divided twice daily for 10 days. The toddler weighs 26 pounds and the suspension available is 400 milligrams for every 5 mils. Which dose should the nurse teach the guardian to administer per dose? Let's go. You guys got this. You guys got this. I'll be right back. All right, what do we got here, guys? Is anybody crying yet? It's not that hard, right? All right. Very good, guys. Yes. All right. The answer is D, 3.3. All right. So this is a pretty straightforward, basic dosage calculation. All right. So you need to take that 26 pounds, divide it by 2.2. All right. And you're going to get 11.8 kilograms. All right. Anybody not get that far? So the daily dose is 45 milligrams per kilogram per day, and then you multiply that by the 11.8 kilograms, and you will get 531 milligrams per day. All right, split it into 2 tablets, divide that by 2, you get 265.5 milligrams per dose. The concentration is 400 milligrams per 5 mils. Do your desire over half, and you will get 3.32, which rounds to 3.3. I know you love it. I know you love it. All right, 4. Let's rock and roll. All right, so this is a select all that apply, guys. Select all that apply. All right, which actions maintain sterile technique? Okay, Mackenzie and Haley say B, C, and E, so does Trina. All right, seems like everybody must be copying off of everybody else. No, I'm kidding. Yeah, guys, the answer is B, C, and E. Right, so pouring solution carefully without contaminating the field maintains sterility, right, B. That outer 1-inch border is going to be treated as contaminated, so keeping items inside that protects the sterile zone. That is C, and opening sterile packages away from the body and away from the field reduces the risk of any accidental contaminating contents, E. All right, so good job. So yeah, Miss KK, don't forget B there, okay? All right. Here we go. Question 5. A guardian brings a 2-month-old client to the clinic and says, I don't sleep unless the baby's right next to me. The baby sleeps best on my chest, and I keep a thick blanket over us so they stay warm. The guardian appears exhausted and is starting to tear up. Which response by the nurse is best? Carl, thanks for the follow, my friend. If you guys haven't already followed, you can do so up here. All right. We do these lives every Sunday, Tuesday, Thursday at 9 p.m. Eastern, so I would strongly encourage you to follow. All right. All right. Thank you guys for liking the live as well. All right. Absolutely, guys. E is the correct answer here. So it is the most therapeutic answer. Okay, it acknowledges the guardian's emotions and their intent, but then also redirects them to some specific safe sleep teaching, okay, without shaming them. Okay, so that is the best answer there. Okay, let's go to 6. All right. Oh, you're welcome, Bella. Or, I don't know, are you talking to me? My name's James, but... Anybody else have clinicals today or work an extended shift? All right. Question 6. What is the nurse's best action? All right. Looks like the majority of you are saying C here. All right. I hope your brains are warmed up. Yep. So yeah, the answer here is going to be C, right? Because 2 elevated residuals with that nausea fullness suggests that there's some sort of feeding intolerance and increased aspiration risk. So yeah, we are going to hold the feeding. That is the safest immediate step. All right, positioning the client with the head of the bed at least 30 to 45 degrees is going to reduce aspiration risk, right? While you reassess and follow whatever your facility protocol is. Okay? All right. 7. Carousel, thanks for reposting. Jennifer, thanks for liking the live. Even liking the live, guys, helps. And if you're finding this helpful, I would encourage you guys to share the live down here in this bottom right corner. That would be extremely helpful to get more people in here. Hamdi, thank you for the rose. All right. The Guardian reports only 1 wet diaper in the last 10 hours. Well, that's not good. Which order should the nurse implement first? All right. Yes, absolutely. Yeah, this baby needs some fluids. So we are going to pick A here as our best answer because drowsiness, modeling, tachycardia, decreased urine output, all of those suggest severe dehydration, poor perfusion. All right, that can very easily progress to shock. So restoring that circulating volume is extremely important, okay, before any other diagnostic stuff happens. All right, good job. Let's keep this trolley moving. All right. The client is oriented to name only, takes warfarin at home, and has a small scalp lac that is oozing. The client says, don't call anyone, I'm fine. Tries to set up quickly. What should the nurse do first? What should the nurse do first here, guys? D, is that what we're thinking? All right. Lisa says B. Liv says B. So we got D and B. Samu says A. Okay. So let's go through this. Okay. So this is question 8. All right. So if you chose A, all right, this is why A is going to be incorrect. So moving the patient right before assessment risks worsening any sort of injury, okay, and delays evaluation. So A is not the correct answer. B, bravo. That is also incorrect. Okay, so any wound care is secondary to assessing for any sort of head or neck injury and neurologic injury, compromise, whatever you want to call it, especially in an anticoagulated fall. C is also incorrect, okay, because the nurse assesses and stabilizes first. So calling for imaging orders is not the first action. So the answer is D. All right, call for assistance. The priority is safety, okay, and rapid assessment. So that includes neurologic status, okay, before moving the client, especially when they're anticoagulated, okay. That definitely increases the risk for intracranial bleeding. So you need to call for help, ensures you maintain spinal precautions, okay. All right, fantastic, guys. All right, that one was a little more challenging. Got a few more different answers there. All right, let's keep it rolling. All right, let's talk about this 6-year-old on chemo being discharged home between cycles. Today's lab report. There's their labs. Hey, if you don't know, the ANC is the absolute neutrophil count. Normal range generally is like 2,500, 7,000. All right. All right. Okay, everyone's back to the B, C, and E. Let's see. Anybody else? Any other answers? Everyone's like, no, Jimmy, this one's easy, bro. All right, so B, C, and E. Let's see. All right. Is A a part of the answer? No. Why? Because A is wrong, because live vaccines are generally avoided in immunocompromised patients, right? Due to the risk of infection from that whatever vaccine strain. All right. And then D. Is D right? No. D is incorrect as well. Okay? Because absolute extreme restrictions are not individualized, okay? And they may be unnecessary if counts recover. So teaching should really focus on realistic risk reduction and when to call for fever. So the correct answer is B, C, and E. All right? So B, C, and E. Good job, guys, if you guys got that. All right, let's go to 10. All right, if you guys are just jumping in, we're doing an NCLEX review on Peds and Peds fundamentals. If you're in school or in nursing school or maybe a nurse currently, this is still just a good review for you. If you're interested, come hang out. If you've never been on this live before, I do these lives every Sunday, Tuesday, Thursday at 9 p.m. Eastern. Okay? So feel free to follow up here. And if you're finding this helpful, you can go ahead and share and repost the live down there. Okay, guys? All right, let's see some answers. I see that there is a more or less a growing consensus of B. Okay. All right. Anyone else? Thank you for the rose, my friend. Thank you for the follows, Latrice and others. Carousel, Melissa, Alex. All right. Thank you for the follow, Candace. Let's see. Y'all are saying B, and that is going to be the correct answer here, okay? Providing smaller, more frequent feeds. So feeding is a major exertional activity for infants, guys, okay? Especially infants with cardiac defects. So fatigue, diaphoresis, poor endurance. All right, this all suggests that the client's burning more calories than they can take in. So we need to do smaller, frequent feeds with rest breaks, okay? All of that supports growth while reducing cardiac workload and oxygen demand during feeding. Okay? So good job on that. Let's go to 11 here. All right, thanks for the follows. Let's see how many people we can get in here tonight. You know, you guys may not know this, but my attendance record is 1,100 people in this live. All right. So it'd be cool if we can get a couple more hundred, but hey, we're rolling. All right. If you do find this helpful, you can repost right here. All right, and then drop your answer in the chat. Okay, number 11, we are talking about a nurse is getting a handoff on a ped step down. Which client should the nurse see first? All right, Sandy, thanks for reposting. This one's got a lot of information, a lot of detail here, lots of vitals, lots of stuff to sift through. No, this is not a SATA question. This is which client should the nurse see first? So in other words, which patient has the highest risk of crashing? Okay? Which one has the highest risk of crashing? All right, I'm seeing maybe more of a consensus on C developing, but there's some B's as well. All right, let's 11. Let's look at A here and see. All right, for A we have tremor and tachycardia. Those can occur with beta agonists. The oxygenation is adequate, and there's no clear sign of impending respiratory failure here. Okay. Let's look at B. Let's just go right down the way, okay? 5-week-old brought to the unit for ED, rectal temp, modeled, lethargic, cap refill. All right, so guys, B is the correct answer here. All right, B is the correct answer. I'll tell you why, okay? All right, so a febrile infant with lethargy, modeling, delayed cap refill is showing possible sepsis with poor perfusion, okay? The looks bad infant can crash fast, okay, and needs immediate reassessment and stabilization, okay? Airway oxygenation, circulation, rapid escalation, okay? A lot of you picked C, okay? Frequent swallowing after tonsillectomy is a red flag for bleeding and is urgent, but this client still has stable blood pressure, has no stated airway compromise, okay? And the infant's perfusion signs are going to be more immediately life-threatening, okay? So that one was tricky. A lot of you said C, right? But here, again, it says unchanged from baseline in C, right? That infant or that 5-week-old in B is way worse off, okay? Somebody said, what about D? Okay, this client likely has DKA, right? They have hyperglycemia, ketones, Kussmaul breathing. Okay, they're still compensating and oriented. All right, so they're urgent, but not the first over that possible septic shock in a young infant. Okay? All right, some of you are saying E. Wow, this was a good one. I'm going to screenshot this for maybe a video later. All right, for E, okay, so E is going to be wrong because it's talking about acute chest syndrome, okay? Although it is a serious condition in sickle cell, but again, the client is stable enough to speak in full sentences, is afebrile, okay? They do need rapid evaluation, just not before the unstable infant. All right? This is a nightmare assignment, though, not going to lie. Absolutely. All right, but give me a thumbs up if you guys understand that, what I'm saying here. This unstable infant needs attention first. Okay? All right. Fantastic. All right. Good. All right, yeah, that was a good one. That was a good one. Let's Let's see what 12 is all about here. All right, nurse is preparing to administer medication through an NG tube to a 6-month-old receiving continuous tube feed. Which action requires the nurse to intervene? Which action requires the nurse to intervene? For number 11, the correct answer was B. Bravo. Okay. All right. Question 12. Which action requires the nurse to intervene? All right. I'm seeing D and A. Cammie, you're not going to die. I promise. Everybody, after you answer, drop some love and send some positive vibes to Cammie. She's taking the NCLEX tomorrow. Cammie, you should not be up more than 30 minutes longer. You're going to bed and you need to get some rest. Get a good night's sleep. All right, and then come back here on my Sunday live and tell us the good news, okay? All right. So the action that requires the nurse to intervene is going to be D, okay? It is going to be D. Drop some love for Maddie in the chat too. She's also testing tomorrow. All right, so D is going to be the correct answer here, all right, because what we call air insufflation, okay, with auscultation is not a reliable method to confirm tube placement, right? And it can falsely reassure the nurse if the tube is actually malpositioned. Okay, in pediatrics, incorrect placement is high risk. Okay, verification should be done using more reliable methods. Okay, we're talking, aspirate characteristics, pH, X-ray. All right, so that's the correct answer there, guys. All right, the correct answer is D, Nikki. Correct answer is D there, okay? All right, very good. All right, guys. Keep going. Appreciate it. Appreciate all the likes going down in the chat. Appreciate you. All right. Let's go to 13. Maram, it is always you, girl. If anybody wants to join Maram in the tap the screen game, you guys just feel free. All right. See how quickly you can get it up to 20,000. It's always Maram's goal. Oh gosh, it just jumped 1,000 in like a second. Oh wow, y'all are going crazy now. All right. So, 3-year-old admitted for RSV, bronchiolitis, and poor oral intake. Latest lab shows sodium 126, BUN 24. Urine output has decreased to 0.4. Child's irritable but awake. What prescription should the nurse question? All right, I'm seeing A and B. Seeing A and B. All right, well, if you guys are between A and B, let's look at C, D, and E. All right, so C is going to be incorrect because treating sodium soon is appropriate to guide therapy and prevent deterioration. So that is a correct thing to do. D is going to be wrong because strict eyes and nose is a fundamental priority when output is failing. So we are going to do that. E is wrong because airway positioning and suction are appropriate supportive care for bronchiolitis. Okay, so we are between A and B. Which is it, guys? Which is it? Are we team A or are we team B? We're not E. Okay, E is incorrect. Are we A or B? Let's go. Drop it. Drop it like it's hot. Drop it like it's hot. All right. It looks like you guys are coming to a consensus of A, and you're correct. It is A here, guys, because a sodium of 126 is hyponatremia, okay? Because normal is 135, 145. We know this because we're smart nursing students about to take the NCLEX, right? So 126 is hyponatremia with decreased urine output. So continuing or starting very hypotonic fluids increases risk for worsening hyponatremia and neurologic complications like seizures, right? We don't want those, okay? And then the rate is also high for maintenance in a 14-kilogram child, all right? So if we're estimating the rate generally using the 4-2-1 method, we're looking at 48 mLs an hour. Okay, so that rate's high. And therefore increasing the fluid and electrolyte risk. All right, so good job, guys. Fantastic job if you guys got that. Let's jump to 14 here. All right, if you guys are just jumping in, we are doing Peds and Peds Fundamentals, NCLEX Review, or if you're in nursing school, hang out. You'll learn something, I promise. All right. The answer for 13 was A. Okay. All right, very good. And if you guys are also new to my lives, you would be happy to know I do these lives 3 times a week: Sunday, Tuesday, Thursday, at 9 p.m. Eastern. So if you haven't already followed, I would recommend and would greatly appreciate a follow from you. Thank you so much. All right, and if you would be so kind as to consider reposting the live, that would be superbly helpful. All right, 14, I see a lot of C's and B's. A lot of C's and B's. So we got an 8-year-old newly diagnosed with nephrotic syndrome. Parent says he's so puffy. This is because I let him eat junk. I did this. What is the nurse's best response? Okay. All right. I will agree with you that the answer is either B or C. The answer is either B or C. Now pick one of those. If you said anything else, go back. The answer is B or C. Okay. Okay. All right, guys. The correct answer is C here. Okay. So you're this specific response, okay, reflects the parent's emotion without judgment. Okay, and then it invites clarification and opens the door for assessment of understanding and coping. Okay, so fundamentals before teaching. Okay, it keeps the parent engaged so education can land later. Okay, so yes, C demonstrates therapeutic communication. Absolutely. Good job, guys. Good job. Let's go to 15. If you guys are also just jumping in and curious, Jimmy, how many questions are you doing? When are you stopping? Okay. We will stop when we get to 10 o'clock. Okay. All right. We will stop when we get to 10 o'clock. This is a select all that make you cry question. All right, 18-month-old brought in with a spiral humerus fracture. The caregiver reports the child rolled off the couch. Nurse notes bruising of different colors in the trunk, and the child avoids eye contact and is unusually quiet. Which action should the nurse take? Okay. All right. I'm seeing this is a select all that apply. If you're just saying C because you think it's C, that's fine. Just know that I'm telling you there is more than one answer. Okay. All right. So I think a lot of it, so there's, the majority of you, I feel, are saying A, C, and E. Some of you are throwing D in there. All right, let's talk about D real quick. Ask the caregiver, did you do this using a calm, non-judgmental tone? Okay. D is going to be incorrect. Okay. So directly asking, did you do this, can definitely escalate and compromise any information gathering. Okay. So the nurse should use open-ended, non-leading questions like, tell me what happened. Okay. And then always follow reporting pathways. All right. Thank you guys for the follows there. All right. Let's talk about B. Okay. For B is going to be incorrect. If you chose B, that is wrong. The nurse should not remove themselves during the undressing process when abuse is suspected. Okay, so assessment and safety require a controlled, observable process and appropriate chaperoning. Okay, all right. So yes, the correct answers here, guys, are A, C, and E. Absolutely. So suspected abuse requires objective, detailed documentation. Okay, you need quotes, measurements, location, and pattern. Okay, that and mandated reporting. Okay, proof is not required. Listen to this, guys. Okay, proof is not required to report suspicion. Okay, proof is not required to report suspicion. Collaboration supports safety planning, appropriate evaluation, and preservation of evidence, all while maintaining chain of custody. Okay? All right, E says ending says preserve potential evidence. Yep, so much better to report and it be nothing than not. That's right. All right. Okay, we good on that? All right, let's go to 16. 16-month-old, 12 kilograms on a pediatric unit. Okay, at 1600, the child received hydrocodone and Tylenol. Contains Tylenol, yep, okay. At 1600, the temperature is 1 and 2.9. Current PRN orders include Tylenol 15 milligrams per kilogram every 4 hours and ibuprofen every 6 hours. Which action is best? There's a lot going on here. Emily says almost at 20. Probably like 12K of those are Maram. No doubt. All right, guys. If you're in here, you heard Maram. We need 25,000. All right. If all 350 of you did this, like, I don't know, 20 times, what is that? Is that like 5,000? My math is terrible. Jennifer, Maram is the biggest hype person ever. She's awesome. Okay. All right, guys. So I'm seeing a bunch of B's flowing in here. Let's see. Yep. Okay. Excuse me. Yes, the correct answer is B. Administer ibuprofen now and hold Tylenol due to that recent dose. All right, so yes, the reason B is correct, right, is because giving more acetaminophen only 2 hours after an acetaminophen-containing product increases overdose risk, right? and violates safe dosing intervals, right? And that's commonly 4 to 6 hours. So ibuprofen here is going to provide that effective alternative. All right. No, lovely gal, I have not. All right. I'm working on it. Stop yelling at me. Lovely girl, I'm sorry. I'll do better. But no, there is like 19 to 20 hours worth of review over there on my YT. I can't mention the name. Under Nurse Jimmy Official. I know, Maram, seriously. I need an assistant. One day. I need somebody to organize a lot of how I do this. There's a lot of efficiency to be had. There you go. Natty's back. Natty says 25K. Let's go. All right. Did I give an answer? Yes, I did. I said it's B. All right. We understand it's B. We're giving ibuprofen here instead of Tylenol. All right. Okay. All right. 6-year-old with leukemia has a central line. Admitted for fever. There's their current vitals. Cap refill 4 seconds. New confusion. Provider orders include blood cultures and IV antibiotics. What should the nurse do first? All right. RG, why wouldn't you call the provider? For which one? Is that... Was there an answer on the last one about? I'm not sure what question you're referring to. But you generally do not call the provider, okay? Unless the patient is very unstable and there's literally nothing else for you to do. Okay? That is a common NCLEX trap. All right, so I see you guys jumping on C. Okay? And you're right. Okay, good job. The answer is, in fact, C, initiate fluid bolus per sepsis protocol. Okay, so when a client has signs of poor perfusion and possible septic shock, right, circulation support is going to be the immediate priority. All right, so we're going to give that bolus. All right, and then we're going to get those cultures, and then we're going to give those antibiotics. Okay? Good job. All right, select all that make you cry again here, guys. All right, a nurse is preparing a 5-year-old for procedural sedation for fracture reduction in the ED. This is not a fun day. Which action should the nurse ensure are completed before the sedative is administered? Select all that apply. Nurse Bond, thank you for the follow. Guys, if you're just jumping in, we do these lives 3 times a week. Sunday, Tuesday, Thursday, 9 p.m. Eastern. Definitely follow. If you guys are currently not already following, there's a ton of content on the page. A ton of content on my main page. If you're studying for the NCLEX, there's a whole 33-part playlist on my page. All right. So follow. Check that out. All right. I also do custom NCLEX study plans. All right. Some of you in the chat, I know, have custom NCLEX study plans that I created for you. So if you guys are interested in that, hang out for a few more minutes. All right, 18 here. All right, I'm loving it. Jennifer, Amdi, love, Kelsey. I've been wanting. Hey, I'm going to give Kelsey, handle Kelsey ASAP a shout out because she makes some fun videos. She's doing like a home makeover. I believe she's got a lot going on. But I enjoy watching Kelsey's videos. So shout out Kelsey ASAP. All right. Yes, guys. The answer is, in fact, A, B, D, and E. All right. So we are going. So the only one that is not there is going to be C. And so C is going to be incorrect because oral intake right before sedation increases aspiration risk. Okay. NPO status must be assessed and communicated, not encouraged. Okay? Not encouraged. So A, B, D, and E. Yes, definitely, Kelsey. You need to pass your NCLEX in May. For sure. For sure. But I'm glad you're here practicing with us. All right, A, B, D, and E are correct. I don't think, I do not think I really saw many other answers that were incorrect. So good job, guys. I don't think I really need to go too much into that one. So we'll keep it moving. We got 12 minutes. Let's keep rolling here. 19. Sandy. Maram has the whole chat on a like goal here. I swear to God. You've reached your 30,000 goal, guys. All right, 19. So a 7-year-old has a long arm cast placed after a supracondylar fracture. Supracondylar? 30 minutes after returning from casting. Which finding requires the nurse's immediate action? Shizzy, I do these lives Sunday, Tuesday, Thursday, 9 p.m. Eastern. Sunday, Tuesday, Thursday, 9 p.m. Eastern. Mark it on your calendar. All right. A lot of you were saying C for 19. All right, and that is correct. Okay, we're going to keep moving through these, see how many more we can get through in 10 minutes. Yes, okay, because pain out of proportion, right? Pain with out of proportion, pain with a passive stretch, and paresthesia are early high-risk signs of compartment syndrome. Okay, that is an emergency. All right, good job. 20. Cynthia Jones, thanks for the follow. Sheezy, thank you for sharing the live. Much appreciated. All right. Emily, I don't know if it's going to happen. I don't know if 50,000 likes in 10 minutes is going to happen. All right. I'm not going to go back to the last question. Sorry. I need to keep this moving forward. All right. Question 20. We are talking about what is the nurse's best action. All right. What is the nurse's best action? If you guys are going to try to reach a 50,000 like goal, you're going to need to convince another 260 people in here to start pounding that screen. Oh, geez. All right. So a lot of you are jumping on A here, and that's going to be correct. All right. So activate the chain of command and follow the facility process. So a neonate with suspected sepsis is definitely high risk for rapid deterioration, period, right? Refusal of potentially life-saving treatment requires immediate escalation through whatever established pathway, charge nurse, provider, ethics, who the hell knows, right? And you need precise documentation, okay? This protects the child's safety then while maintaining professional boundaries, okay? Like legal and ethical. Okay? All right. Kathleen, thanks for the follow. Let's jump to 21 here, guys. Let's see. KMGR21, thanks for the follow. Yeah, Cat says, I don't like the wording. Well, I'm sorry. You may not like the wording on some of the NCLEX questions either. It's just going to happen. All right, a nurse is receiving a report on a pediatric unit. Which client should the nurse see first? Lots of information here, guys. All right. read these and think which patient is going to crash the fastest. Okay? Be on the lookout for things that say, all right, well, they're kind of sick. This is probably urgent, but maybe they're stable for a little while. Okay? Find the one that is like no shit, like on the verge of dying. Okay? All right, I'm seeing C, A, D. All right, we're gonna screenshot this one too. You guys might actually hit your 50,000 like goal. You guys just got 10,000, 11,000 likes in 3 minutes. Jeez Louise, you guys are crazy. You guys are crazy. Emily's like, yes, it was a goal, must get it. All right, I'm seeing A, C, D, and B. Geez, you guys are, I think the only answer I haven't seen pop up was E. You're just like, oh, sickle cell, afebrile, stable. Right, yeah, it's definitely not E. Good job, guys. Good job not saying E. Okay. So let's go down. Let's say, let's look at A and break it down. All right, so A is gonna be incorrect. Okay, post-tonsillectomy bleeding is a real threat. Okay, but this is still a red flag, right? Without confirmed hemorrhage. Airway instability from a fresh trach is going to be more immediate, so I gave it away. C is the correct answer here. Okay, so A is not as bad as C. C is somebody that is actively losing their airway. Okay, that O2 sat went from 95 to 88. You don't want to see it drop any further. Okay, so that airway problem beats everything else. All right, because that kid can decompensate in seconds. All right. Some of you said B. Okay, again, this suggests DKA, and they are still compensating an alert. It's urgent, okay, but not first over the airway issue. Some of you said D. Okay, increased worker breathing, again, is concerning, but the SpO2 is maintained. There's no sudden event like a trach compromise. Holy moly, you guys did it. Don't doubt my commitment to getting 50K. All right, Emily, Maram, you guys are in charge of the like goals moving forward. Maram, I think you just recruited Emily. Hamdi, I know you were in there. All right, so 21, Kamari, the answer was C, okay? The 18-month-old with the trach. All right. All right. Oh, thank you, Maram. Maram's like, you deserve it. Thank you. Clearing the throat could be bleeding. Yes, correct. Tune 23. Clearing the throat could be bleeding, but when you have a patient that is actively desatting and has lost their airway, that's going to be the first one. Okay, that's going to be your biggest priority. All right, 22. All right. Samuel says respiratory is going to handle the trach. The answer to the last one was C. It was that 18-month-old. All right, nurse is about to give amoxicillin to a preschool-aged client. The parent says, he broke out in hives the last time he took penicillin. The electronic record lists no allergies. What's the nurse's best action? Okay, I'm seeing A and D. All right, 22. The answer is definitely going to be A here. All right, hives after a penicillin allergy after penicillin strongly suggests that there is some sort of like IgE, some immunoglobulin E-mediated allergy, okay? And it does place the risk, client at risk for anaphylaxis with re-exposure. So we need to do some safe medication practices and just reconcile that information before giving. I mean, it makes sense, okay? It's amoxicillin. They're probably stable. Take the extra time, right? And get it right. Okay? All right. What are y'all saying? I'm just, I am behind. I'm not able to keep up with the chat. One of the other positions I'll hire for is a moderator in the chat. All right. Let's jump a little bit further ahead here. Let's see what 27 is all about. All right. This is a select all that apply. All right, a nurse realizes a school-age client received a double dose of oral medication because the parent administered it shortly before arrival and the dose was not communicated during admission. Which action should the nurse take? All right, which action should the nurse take? This is a select all that apply, guys. This is a select all that apply. Yes, A is part of the answer. What other letters are involved here? Okay, I'm seeing some A, B, C, and D, some A, B, and D, A, B, and D, A, B, C, and D. Okay. Let's walk through these. Let's start with A. All right. So, all right. Assess the client immediately for adverse effects and obtain vital signs. Yes, 100%. I think we all agree, right? Yeah, the first priority is going to be assessment and monitoring. All right. B, notify the provider and charge nurse per the policy with the medication name, dose, time given. Yes, absolutely. Reporting up the chain of command supports timely decision making. Okay. For any additional labs that they might want to do, antidotes, observation, right? C, no, right? C is incorrect. Okay. C is incorrect. The medical record should objectively document what was given. Okay. Assessment findings. Provider notifications. It should not mention incident report completion. All right. Let's look at D. D, yes, correct, is going to be, D is in there in the answer set. So complete an incident report per facility policy. Okay, the incident reporting supports system improvement. All right, and then E. E is also in the answer set. It is a correct answer choice. Okay, so improving reconciliation reduces recurrence, okay? And these are the very, very basics of fundamentals. So the final answer, A, B, D, and E. Let's go. All right. You guys are awesome. 57,000 likes. You guys, your fingers must be tired. Okay? Holy moly. All right. While I still have 207 of you here, are any of you interested in custom NCLEX study plans? All right, I know there's a few of you in there that are currently using them. I would be happy to kind of run you through that, guys. All right, if you are, you're welcome, guys. You are welcome. So one of the services I do is our custom NCLEX study plans. So they are custom. They come out to usually be about 7 pages. They're tailored to you, your weaknesses, your amount of time that you have to study, your subscriptions that you already have access to. Okay. Yeah, you're kind of right on the border there, Emily. You take your test on the 10th. You're kind of right on the border. But yeah, I mean, I would suggest about 2 weeks, roughly. I'll show you guys how to go ahead and find that information. So if you go to my profile page, all right, Analuso, thank you for the follow. Grace, absolutely very interested. I'll be a repeat test taker in March. This is perfect. Okay, so it's for first-time test takers. It's for repeat test takers. So if you go to the link in my bio, all right, I've now created it, I think about 115 of these with a lot of success, guys. If you're interested, you scroll down a little bit further. You'll see I love getting these DMs from people. Hopefully Esther reaches out. She jumped in the beginning of the chat that said that she'd passed the NCLEX. All right, so this is all done with the study plan. All these guys, these gals, okay. You get that right here, this top link, okay. 60,000, Maram, geez Louise. Okay, so you fill out your information, name, last name, all that standard stuff, which NCLEX you're taking. Okay, if you are a repeat test taker, all right, you're going to say, no, this is not my first time taking it, and it's going to ask you for some information about your CPR. Okay, so dust off your CPR and type in here, what categories were you above the passing standard and what categories were you below the passing standard, okay? So drop that information in here. This helps me customize the study plan to your weaknesses, all right? Drop your test date in here. If you don't have a test date yet, just estimate when you feel like you're going to want to be testing, okay? If you already have a subscription service that you use for learning, quizzes, all that stuff, drop that in here. If it's not listed, mark other. Okay, Grace, good question. If it's not listed in here in above or below, I assume that it's near passing. Okay. All I want are the above and below. Okay. Anything else I'm going to assume is near. Your CPR, Emily, means Candidate Performance Report. So if you take the NCLEX and you do not pass it, NCBSN will send you a Candidate Performance Report, and it basically just shows you what your weak areas were and your strong areas were. Okay, so that information goes up there. Select what resources you have access to. Yes, absolutely, Bella. It can help Canadians studying for the LPN exam. All right. Select any topics that you feel that you know, just without a doubt, hey, I'm weak in maternity or I'm weak in respiratory, okay? Or other, fill in the blank, anything else, okay? Then this is where it gets super customized, okay? Because not everybody has the same amount of time to study. You might only have 4 hours on a weekday and 6 hours on a weekend, or vice versa, whatever the case may be. Put a number here for how many hours a day on those that you have to study. And then what days of the week are you available? Because you might not be available any Saturdays. You might work weekends. When I was going through nursing school, I worked every single weekend. I was a weekender. I worked full-time through nursing school. It's a grind, okay? But here, this will give you some structure, even if you're super, super busy. All right, so select which days you're able to study. Tell me what your test anxiety is, 0 to 10. All right, and then literally anything else that you're able to tell me about your situation, your learning style, things you've tried in the past that you feel worked and didn't work. Okay, let me know here. That's going to help me make this as specific and customized to you as possible. Okay, and then it's $25. Okay, I thought that was a reasonable price. And it's a hell of a lot cheaper than taking the NCLEX again. All right. So it will give you a very standardized plan. It will tell you what to do, what to study, what subject to study every single day. All right. It'll give you a weekday schedule and a weekend schedule, Monday to Sunday. And it'll break it up into blocks. So you can do block 1, 50 minutes. Here's your question set. Take a short break. All right. And then it'll just keep going. So Emily says, I've been studying for months now. I only have about 12 days left. Even though you have 12 days left, Emily, I could get you. The plans typically take, once you submit the form, 1 to 2 days, but I could get you your plan tomorrow. I know that's you got 12 days, so if you did opt to do it, I could get you your plan tomorrow. Who's at fault? What platform is this on? I don't know what you mean. The form is found within the link in my bio. And then the platform is going to be whatever you're currently using. Okay? So who's at fault? If you're using Bootcamp or Simple Nursing or UWorld, you just put that information into the form. And when I create the plan, I'll reference whatever subscription service you're using as your resource. Okay? Okay. All right. You guys are chatting. Emily said, okay, I'll take all the help I can get. All right, perfect. All right. The website that the form is hosted on is JotForm. I'm not sure if that's what you meant or not. Is it only $25 during this live? No, Bella, it's only $25 ever. All right, it's only $25 ever. Yeah. Okay. So that is that. Oh, let me show you. There's still 94 of you here. Back on the profile page. So here is the full NCLEX review. All right, 33 posts. There's a lot of high yield information on there that I would definitely strongly recommend you check out. And then I post NCLEX tips. All right, some other like nursing school related stuff. Lots and lots. And then I've got some stuff on burnout. So I'm just kind of got a lot of stuff going on. Do you work with Hearst? Grace, if you use Hearst as your like NCLEX study platform, just put that under other, okay, when you fill out the form. And then anything I reference for your plan will be specific to Hearst, okay? All right, so hopefully that answers your question. Back here, guys, also I have the NCLEX Vault, which is just a compilation of cheat sheets entirely for free. Okay, it's about 230 pages. Yeah, I know, that's a lot. So all it requires is your name, email, and then you click Access Now, and it will open. Okay, the vault will unlock and open, and there's a lot of amazing high yield cheat sheets in here. This is basically what it looks like. It opens with tabs. You'll have fundamentals, maternity, peds, pharm, cardiac, respiratory, neuro, endocrine, renal, GI, infection control, psych, mental health, leadership. Literally so many questions. And then after each section, there's a 25 question quiz of increasing difficulty. Okay, one of my favorite sections is the strategy corner, where I break down the NCLEX itself, some things that I teach students about how to approach questions of different styles, from standard choice to select all that apply. We just did a whole NCLEX Live on Tuesday about breaking down SATA questions. All right, how to answer case studies, bow ties, drop downs. Okay, so definitely check that out. That is entirely free. Okay, so all right, so that's pretty much it, guys. So I'll give you a couple more seconds. If you haven't already followed, you can follow up here. And Rosalinda says, I have 15 days. How can you help me? Yeah, so Rosalinda, the biggest thing I can do for you is create that custom NCLEX study plan. Okay? create that custom NCLEX study plan for you. And that would be the biggest thing I can do. Again, you go to the link in my bio right here that beacons, and then click get a custom NCLEX study plan. All right, fill out the form as completely as you can, and then it's $25. Okay. Bella says, when's the next live? Next live will be Sunday. Okay. So I go live every Sunday, Tuesday, Thursday. All right. Barring some sort of holiday or me being dead sick. Okay. Tired isn't really a thing, even though I do get tired. I worked 12 hours today in the emergency department, but I am here. I'm here for you guys. Okay. So we'll be here. I work Sunday as well, and I'll be here Sunday. Okay. So Sunday, Tuesday, Thursday, 9 p.m. Eastern. That's it. So Bella, yeah. So once you submit the form, it comes out to usually about 7 pages long. And I will send it to you in 1 to 2 days. Okay. 1 to 2 days. Emily, fantastic. I just saw the banner notification come in. So, I will get that to you ASAP. Okay. I know you're on a tight window here. Okay. All right, guys. That is going to do it for me. I'm going to go to bed because I have to work tomorrow. All right, Mau and Company, how do I pay? You pay in the form. Mau, you pay in the form. There's a payment section at the bottom of the page that takes your credit card information. Okay? Are we good, Mau? Mau and Company? Mau? Okay. All right. I'm going to take that as you are all set. Perfect. All right. Well, I look forward to working on all y'all's study plans. Definitely get those in ASAP so I can knock them out for you. All right. Until then, until Sunday, we'll see you guys. Cynthia, turnaround time, 1 to 2 days. 1 to 2 days. More on the 1 day side of things. I'm usually pretty quick. Okay, Mau, $25 is what I felt was reasonable for the plan. Okay, it's cheaper than taking the NCLEX again. All right, I can't guarantee a pass, obviously, but it is a really good resource to help you maximize the resources that you're currently using. Okay, all right.